welcome to our presentation today. I'm Dr. Lynda Young, and I am here with the Worcester District Medical Society, and we work in conjunction with WCCA TV to present Health Matters, where we present topics that are of interest to, I hope, everybody, and we end up meeting some wonderful people with wonderful things that they're doing. So today with me here, I have Dr. Arvin Garg, who is the founding director of the Child Health Equity Center. Dr. Garg is a professor of pediatrics and vice chair of health equity for the Department of Pediatrics at UMass Chan Medical School and associate chief quality officer for health equity at UMass Memorial Health. Also, as our guest, we have Alison LeBlanc. Alison is the executive director of the Child Health Equity Center. Ms. LeBlanc is a development strategist and child health equity advocate with over a decade of experience designing and implementing initiatives to address adverse social determinants of health. These are very important topics, and I'm really anxious to learn more about the center and what they bring to our city and to our medical school and health center. So welcome, and thank you very much for joining us. Yeah. So my first question, what is child health equity?
It's a great question, Linda. I'm so glad you asked. I think for us, child health equity is when all children, regardless of where they live, their race, their religion, their parents' background, have the same opportunity to grow and thrive.
Yeah, makes sense to me. Anything to add?
No, I mean, it's hard to follow Alison, as I know. But health equity, Robert Wood Johnson defines it as everyone having a fair and just opportunity to achieve health, no matter what the circumstances are. And I'd say in America, in the U.S., and really globally, children, the roots of health inequity start in children. Mm-hmm. When they're born, their first breath, we know some kids are going to thrive, and we know some kids, based on their socioeconomic status, based on their color of their skin, based on where they live geographically in the city of Worcester, we know that the deck is stacked against some kids, more so than others. And so for us to achieve equity, we want us to try to get the root causes of what drives it for children and their families. And it's really around social determinants of health, which we'll talk more about, mm-hmm. As well as racism that affects our children of color.
So I think this is always because as you know, I'm a pediatrician, and this has always been an issue for a lot of us that practiced. And I think that the pandemic has absolutely brought this front and center. And we see that people of lower socioeconomic, people of color, they're really feeling a lot more of the profound effects of this. And it's really brought this to, I think it's a good thing in a way, not that we had a pandemic, but that this issue has really moved forward. So more specifically then, why is this so important? You already mentioned a few, but you could go on and on, I'm sure.
I can. I'll start with this one. It's, as a pediatrician, we see this on the front lines. We know in the United States, since 1967, I think, children are the poorest segment of our population. It used to be the elderly, and then social policies with Medicare and Medicaid were enacted, and since then, children are the poorest segment of our population. 2 in 5 children in the United States live in low-income households. When we look at Worcester, over half of children live in low-income households. And so, poverty gets underneath the skin to really affect the biology, the pathophysiology of children. And those effects aren't only in the short term, but also in the long term. And it affects how they learn, how they grow, what they achieve, what they're able to achieve, and it affects them as adults, and it affects our society at large. And so without having an equal playing field, and acknowledging that despite our lore of the American dream, which brought my parents to come to America from India before I was born, that American dream isn't achievable the same way for all children. And so you're absolutely right. COVID, the pandemic, exposed this in a way that was really under the underbelly of society and children and pediatrics. And this is a unique moment in time that we're all trying to galvanize to try to capitalize on this to help children across the country and here in Worcester.
Mm-hmm. So tell us about the center. What's that all about? This is exciting for us.
Yeah, the center is an exciting endeavor that we're starting in collaboration with UMass Memorial Health and UMass Chan Medical School. So we brought together child health equity researchers, and we're working on research that will help build the evidence base around child health equity. So we're working specifically to address adverse social determinants of health, including racism, poverty, food insecurity, housing insecurity, transportation insecurity, and really trying to understand the root causes of these things and how we can mitigate these adverse social determinants of health for our patients and community.
I think, again, I'm going back to the pandemic, and I think one of the most horrible things that happened to children was that they didn't go to school. They couldn't go to school, and that really put a divide into this social equity. If many of these people did not have access to the internet, so these children never, ever were able to go to school. And I think people realized that and thought, oh my goodness, that's a travesty. So tell me some more about what the center is doing and how they're working within the school, within the system, and within our city.
Yeah, it's a great question. And we're newbies to Worcester, but we're so excited to be here. So I think the first stage is getting to know our community. So getting a chance to speak to you today and to speak to community partners. There's so many great social agencies here that their whole mission is to lift up children and lift up families, and we're trying to make those connections. And we've learned so much already, and we're continuing to learn more and more about the community and about the resources that are available. I think I come from an academic background. I was in Boston Medical Center for 10 years, and I feel like a lot of times in research we're very siloed. And, if we're thinking about promoting children's health and development, it has to be an all hands on deck approach. That means we have to be communicating from the medical side with the school systems, with early childhood, with social services, food pantries, housing resources. We need to work with DCF as well, Department of Children and Families. We need to try to galvanize ourselves together to think about how do we make a better structure for our children and not work in isolation, but work together to achieve that goal. And I think everyone's well-intentioned in every committee I've been at, but we haven't had that opportunity to really try to work more collaboratively together to achieve this goal. There's certain parts of Worcester where if a child was born and grew up, their life expectancy would be 10 to 15 years less than two neighborhoods over. And so, I think we're really grateful to be in this community because there's so many people who are devoted to this, from the Department of Public Health to social agencies to the health system. So right now we're just trying to listen and learn and grow and think about, as we recruit academic general pediatricians and researchers, child health equity researchers, how do they fit in the rubric of this community, and how can we not only help advance science and child health equity for the nation and globally, but also most importantly in this community. And so the first step is to understand our community. And so again, we're so delighted to be here to engage in this, and hopefully folks will watch it and can reach out to us with questions, concerns, and their thoughts.
And so, Alison, you mentioned social determinants of health. So that's a term that it took me a while to get my arms around. Can you explain in something that I could understand, and how those, and maybe give some examples of how that affects, like I made the example of they had no internet connection, so they couldn't go to school. So, but there are a lot more of those, and they're absolutely here in Worcester. So,
yeah, absolutely. It's a great question. I think it's a lot for people to absorb that these things do impact people's health. And I think one of the easiest sort of examples I can think of is transportation insecurity. So there are many people that don't have access to their own private vehicle, or do not have the funds to purchase gasoline, or perhaps can't use public transportation. And for those people, it's very difficult to keep up with medical appointments. And so, for example, well child visits. And we know well child visits are preventive care for our children. And so if folks are missing those, especially repeatedly, that can be detrimental to the child's health, growth, and development. And I think similarly with food, we all think of food as something that is often easy to access, but not everybody has easy access to food. And even for those they do, they may only have the funds to buy unhealthy foods, those cheaper foods that are at, fast food restaurants and things like that. And so part of the work that we're doing in Worcester is partnering with grocery stores that sell fresh fruits and vegetables and giving our patients access to a debit card that will allow them to purchase those fresh fruits and vegetables for their family. And that will really help their nutrition and their overall health.
So I think one of the things that you don't realize this, and you think, well, goodness, there's the grocery store, it seems like on every corner, but that isn't true. And if you have no transportation, you're not going to go and buy a week's worth of groceries, because how are you going to carry them home? And the other thing is oftentimes, and I used to, we had a fairly large Medicaid population in our practice, and it would never dawn on me that probably the closest thing for them to go to was a 7-Eleven or a Honey Farms or something like that. There's not sometimes they have bananas, but there's really not a lot of healthy choices, and they're looking at high fat, high salt food that just is there. It's around the corner from them, and that's where they shop. It's also expensive. So I think once you start realizing this and how you can make things better, a debit card, some kind of transportation. I know that there are a lot of agencies that you're probably talking to or will be talking to that can provide those services or provide some of those services to allow them to have access to this. So tell me some more as far as you mentioned transportation. I always hear about food deserts where there's no grocery store around, and I feel very privileged that I can get in my car and drive less than 5 minutes to a large grocery store.
Yeah.
I don't walk home from there. It's like that would take me almost 15 minutes.
Yeah.
Absolutely.
But I'd have to carry my milk, and I'd carry my frozen stuff and everything. So you don't realize these things. So I'm hoping that this will raise our viewers' awareness about all of this.
Yeah, I agree. And, when I trained as a physician in the 90s, I think we thought that if we provided good care to our patients, then they would be set up for success, regardless of where they came from, regardless of these barriers. It just wasn't as part of my training during medical school. But over the past 10, 15 years, there's been a recognition that really what drives health is social determinants of health, which is defined as the social circumstances in which people are born in, grow, live, play, and thrive or not thrive. And 80% of health is driven by these social circumstances, by these social determinants of health. And like Alison said, there's these critical unmet basic needs, unmet social needs like food, housing, employment, education, childcare, utilities, transportation, legal issues that can really affect a child's and a family's ability to thrive. I'd say to take a step back from social determinants of health, though, another word we can use, quite frankly, is poverty. And structural racism, because all those risk factors that we're going to talk about for food and housing disproportionately affect children who are poor. And like I said, in America, children are the poorest segment of our population, but children of color disproportionately are poor. So the majority of Black and Latinx children in the United States are low income. And since 2020, the majority of children now are children of color. And so from a public health standpoint, it's critical for us to think about the investments we're making in children. The American Academy of Pediatrics president, Dr. Morris Lodge, says children are 20% of the population, but they're 100% of our future. And, when we think about the social determinants, it's not, and I think that's where our field led on social determinants, because we see a child in front of us. We know that it's the choices that they've made doesn't influence their living circumstances. Like they're there as part of their larger family context and cohort, and either it's randomness or some spiritual guidance or something that has led that child to that family, to that social circumstance. And me personally, I think about that all the time when I was growing up, because my dad grew up in poverty in India, and I used to travel to see his house when I was on vacation, school vacations for every other summer. And I would see all these millions of children, at the bus stop, on the streets, just really impoverished, and in a way that just takes your breath away, and it always stuck with me, like, how did I grow up in a nice, lovely suburb outside of Boston, having this life where all these other children are suffering from these social circumstances, social terms of health. So, I think that the medical system is now recognizing that this is really driving health. 80% of health is really driven by the social circumstances. Children are particularly vulnerable because their brains are developing, their bodies are developing, their emotional intelligence is developing, and those stimulations, those toxic stress on the other side, conversely, can really affect a child's health and development potentially throughout their whole life course. And so that's what I'm really passionate about, trying to parlay the medical system, using that opportunity with children as a public health platform to really try to address some of these root causes of health inequity, which is social determinants of health, which is really poverty, and structural racism that's related to poverty.
So this is something that I think is so exciting to have in Worcester and to have as part of the health system at UMass. So tell us how is this going to impact our city and our surrounding towns too, but how is this going to impact Worcester?
That's a really good question. I think, the first thing we did when we arrived in Worcester, we both came from Boston Medical Center, is really reach out to the community and understand what's already happening. Because I think the important thing for us to do is not duplicate any efforts. We want to work with those that are already doing the good work in Worcester and really bring everyone together to make sure we're all rowing in the same direction. So to that end, we're hosting a Child Health Equity Summit this May for 2 days in the community to bring together stakeholders from all different disciplines, from the public schools to community organizations to government organizations, healthcare, researchers, parents, community members, to really talk about the threats to child health in Worcester and how we can work together to mitigate those things. I think when we're all working together, we're much stronger, and that work is much more sustainable. And it really allows us to maximize the resources coming into the city and ensure we're not duplicating anything, but we're really building something that can benefit today's children and children for generations in Worcester.
So tell me about the research that's going to be happening, or probably has been started already. Again, great resource with the medical school and also with all of the colleges and universities that are in this town.
Yeah.
So lots of things to let people know about. So tell me about how you're working on that.
Yeah, it's a great question. I think, just take a step back, I think Worcester is a perfect city for us to be doing this work. It's the second largest city in New England after Boston. There's a humility to everyone we've met here that just kind of takes your breath away. And at least for me, I just feel like everyone's here that we've engaged in with the community partners as well as the health system, folks who are here for the right reasons and who want to engage in this work in a really meaningful manner. And so we have a small research cadre, about 5 child health equity scientists, pediatricians who are scientists, and we're working on various aspects, social determinants of health, trying to think of using the medical system to help link families in need to community resources and study its impact on health and development. We have a researcher who is working in the asthma field, and she's working on clinic and school partnerships to try to increase the adherence of medications and the better quality of life that can lead to for children who are, again, those who are most at risk are those who are low income, and she's really working with that population on these partnerships and been doing it for many, many years. That's Dr. Trivedi. Dr. Anisha Fahy is working on really a global perspective. So she is working in India with some community partners to think about how to increase the ability for children to thrive in a resource-poor community. We have Dr. Sarah Beth Broderfinger, whose life's work's been devoted to working on children with autism, a really vulnerable population, and to think about how can we create linkages to resources in a more equitable manner and in a more efficient manner than we are currently. And so that's kind of like the tip of the iceberg that we're hoping to do. And, for us, again, we want to take a humble approach to listen and think about what are the needs in the community. And then I'm really excited for the summit that's going to happen in a couple months to really kind of dig in some more. And I think from the summit, we'll have a better roadmap of where we want to go and to invest in with community partners as well as future researchers to join our team.
Have you already connected with some of the community agencies, of which there is a wealth, by the way? And I'm going to give a shout out to our Department of Public Health and to all of the agencies that are out there. I hope you were surprised pleasantly at what we have to offer.
Oh my goodness. We were so overwhelmed with the support we received. I think neither of us being from Worcester, we were a little hesitant at first. How are people going to receive us when we kind of just cold call them and say, can we have a meeting? And universally, everyone was very welcoming, very happy to partner with us, to learn from us, learn with us, was happy to share their journey. The many people that we've met, there's just too many to count because I don't want to leave anyone out. But there have just been so many from different sectors that have really embraced our presence in the Worcester area and really been thoughtful about ways that we can collaborate with them and collaborate with them and the hospital particularly, so we can get access for our patients to some of their services. Mm-hmm. So many of the community organizations offer excellent services on their own, and having access to those services would be really beneficial to our patients. So I think those partnerships are going to continue to be bidirectional and duly beneficial for both ourselves and those organizations. And we're just thrilled with the reception we received and really humbled by the many great people in this city working towards equity.
And I'm assuming you're involving our school system.
Absolutely, very critical.
So have you gotten ideas from them, or have you met with people there already? I would assume that that's a key place because that's where the kids are.
Yeah, no, it's a really great question. We have been reaching out to the schools. We're excited to share that some of the school nurses and school leaders will be joining us at the summit, which we're thrilled about. We've even talked to some teachers that are in the classroom, actually done a few Zooms with teachers who are actually literally in the classroom while they're Zooming with me, which is fantastic to really get that kind of insight. So really loving working with the schools from top to bottom and getting to understand the different schools in the city and how they operate and the students that they serve.
And other agencies that are around, besides schools, besides healthcare agencies, tell me about some of those that you've been in contact with or you will be in contact with. I think it's interesting to hear all the resources that we have that a lot of people don't know about.
Yeah, absolutely. Department of Public Health is a resource. I cold emailed Dr. Castillo, the commissioner, and she's been a phenomenal advocate for us and partner and a connector as well. And then the social service agencies, community legal aid is an organization that's been really a big assistant to us since we got here, and they've been doing great work with pediatrics for many, many years at UMass Memorial Health. Social services, so thinking about the food pantries, the food bank as well, thinking about the employment resources for our community, learning English as a second language resources and communities. So there's a whole bunch. I'm sure Alison can fill in more as well that I'm sure I'm missing, but we want to kind of paint a wide coat to really understand what is here. And every day we're learning more and more about the resources, and it's incredible, and it's truly inspiring for us to keep on doing the work we want to do.
I think I'm sitting here thinking of all the things that are available and all the agencies and everything. And then, of course, I always think about, have you been talking to the WCCA? Have you talked to them? They might think this is a terrific idea. Yeah. So lots of things. We can keep you really busy.
Yes, that sounds great.
A lot of good stuff there. So how... can you tell me, are there certain agencies or communities certain agencies in the community that have been particularly helpful? You don't have to call them out necessarily, but particularly helpful, and what sorts of services or what sorts of things have you been able to partner?
Sure, that's such a great question. I think there have been so many that have been tremendously helpful, but I think those working on the community health needs assessment have been really, really helpful to us because they are kind of doing this work and really have worked with the community to understand the needs. So those folks are exceptionally helpful. The Worcester Community Action Council, which is doing great work, particularly with employment, has been fantastic. And Community Legal Aid, of course, is a longstanding partner of the Children's Medical Center at UMass and supports our patients in a lot of ways. So I think there have been many organizations that have really stepped up and worked with us creatively to think about how we can either create a collaboration where one doesn't exist or up-level a collaboration that already exists.
So I'm hoping that there'll be some listeners that are going to say, hey, I want to contact these people. So we will provide contact information. This will go up on our website also with Worcester District Medical Society. But as we had said, this goes very quickly, and we have about a minute and a half left. So just so you know. So I'm going to ask if you could kind of give us just a little bit of a wrap-up. If there's something that I forgot to ask or something that you want to have us know about, now's your chance.
Well, I just want to thank you for the time to have us here. We are just thrilled to be part of this community, to really try to work with families, with stakeholders, with community agencies, with physicians, with anyone who cares about child health equity, to partner with them. And we are so excited to be part of this community, like I mentioned, and to dig in and try to achieve this elusive goal of health equity for the children of Worcester.
I think it's a great thing for Worcester to have this, and I'm looking forward to seeing all of the good that comes out of this and all the collaboration. So I want to thank you very much, both of you, to Arvin and to Alison. Thank you for taking the time to be with us, and thank you very much for listening. Thank you for joining us, and we are at the end of our show. This is the Children's Health Equity Center at UMass, and I thank you for being here. So thank you very much.